Thank you for that introduction. I would like to start by acknowledging that the land on which I live and work is the traditional unceded territory of the Algonquin Anishinaabe people. The Algonquin peoples have lived on this land since time immemorial. I am grateful to have the opportunity to present in this territory. Here's my disclosures. So today what I want to do is to give you a brief overview of the various types of debridement, but really focus on the Nurses Specialized in Wound, Ostomy and Incontinence Canada's debridement best practice recommendations for nurses. You can download the document for free from the NSWOCC.ca website, and the link is here on the screen. So as a disclaimer, these recommendations are not binding on nurses or the organizations that employ them. The application of these recommendations should be based on individual needs and local circumstances. They neither constitute a liability or a discharge from liability. While every effort has been made to ensure the accuracy of the contents at the time of publication, neither the NSWOCC or the authors offer any guarantee as the accuracy of the information contained in them, nor accept any liability with respect to loss, damage, injury, or expense arising from an error or omission in the contents of this work. References to products or educational programs within this document do not constitute an endorsement of these products or programs. So let's start by defining debridement. So wound debridement refers to the removal of adherent, dead, or contaminated wound tissue. It should not be confused with wound cleansing, which is the removal of foreign material or wound exudate, nor should debridement be confused with amputation or the removal of vitalized tissues. What are the indications for wound debridement? Debridement, we know, plays a critical role in wound management. And I'm sure that you're going to hear Dr. Sibbald and Dr. Aiello talk many times over the next few days about the wound bed prep paradigm and how important wound debridement is and part of the wound management journey. Determining when and how wounds are debrided is dependent on the patient's underlying diagnosis, general health, type of tissue to be debrided, healthcare setting, and the skill of the clinician. Timely and appropriate debridement can reduce wound bioburden, promote wound healing, and improve patient quality of life. We have to note that more than one method of debridement may be required at different stages of the wound management process. So if we look at the different types of debridement, we'll start with autolytic. Now, I'm not going to read everything that's here on the screen. You can read that yourself. But basically what we have to remember is that we should be looking at uncomplicated acute and chronic wounds with minimal amount of non-viable tissue. It's a selective destruction of non-viable tissue, and it activates our enzymes that are naturally presented in the wound fluid to soften the necrotic tissue. Now, remember, we need to make sure that wounds are healable before we do autolytic debridement. So for instance, if you have a dry black heel, you do not want to be wetting that heel. So we have to go back to that wound bed prep paradigm. We need to know the etiology of our wound, whether or not it's a healable, maintenance, or non-healable wound, and what our goals of care are. And this goes with any form of debridement. Mechanical debridement is a rapid process of removal of a large amount of slough. It may disrupt biofilms. Some methods are readily available, suitable for care in most settings. Most methods are within the scope of practice for all categories of nurses. Enzymatic debridement is a selective debridement that's suitable for all care settings. Minimal training or expertise is required. Fast application, suitable for use in adults within the scope of practice for all categories of nurses. It's non-traumatic and usually not painful. But we understand that it may not be available in all practice settings. Biologic, this is a selective form of debridement. And Dr. Hari Krishna Nair, who I believe is there with you, he is kind of the leading expert on biological debridement. It's not something that I personally do in my practice. It's not readily available in Canada, but in some places they do use it. We have it more unintentional, where a patient will come in with maggots in their wounds. Now, conservative sharp wound debridement, this is what many nurses do with added skills and training. We know that it's fast and effective removal of non-viable tissue, that of bioburden and biofilm. So it helps support that rapid healing. But we need to remember that you need to have additional training. You need to have the knowledge, skill, and judgment in order to do conservative sharp wound debridement. Surgical debridement, at least in Canada, is normally reserved for physicians, podiatrists, chiropodists, or nurse practitioners. They may or may not require anesthesia. It's a selective form of debridement. It's speed. It stimulates the healing process. It can reduce peak plantar pressure caused by calluses, removes biofilm and infectious tissue. But once again, there's a lot of added skill, knowledge, skill, and judgment required. So let's look at the Canadian best practice recommendations set out for nurses. And I'm going to give you the abridged version, and you can read the entire document in the link I provided you. So number one is scope of practice. All classes of nurses must work within the controls of federal, provincial, territorial legislation, regulatory bodies, organizational policies, and individual competencies. And I think that's really important that we remember individual competencies. For debridement of wounds, this includes having the knowledge, skills, and judgment, and the authority to perform all methods of debridement. As nurses, we are accountable for knowing our national code of ethics, expectations, respective provincial territorial practice standards, and guidelines. We have to know our employer's policies, procedures, and operational guidelines. And we have to ensure that we have the competence and know the limitations of all methods of debridement. So if you're working outside of Canada, you need to know what your country's or region's legislation is around your ability as a nurse to debride. Organizational recommendations. Employers and organizations should ensure all policies and procedures or operational resources related to debridement, including the type or method of debridement of each class of nurse, is authorized to initiate and/or perform, including the specific level of education, training, including mentorship and expertise required to perform the method of debriding, meaning that we should have organizational support for nurses to debride, and then we should have our policies in place that are going to help protect the nurses and ensure that we have the proper training in order to be, and mentorship in order to be able to debride. Prior to the initiation of debridement, the nurse must be knowledgeable about the different types of debridement and the level of skill and training required to perform each method, be aware of our own attitudes, limitations, skills, and competency, recognize the indications, precautions, and contraindications for various debridement methods, evaluate the patient's health status and wound goals, wound assessment findings, and wound healing potential to determine if a consultation with the interprofessional team would be beneficial to confirm decisions regarding debridement. To be able to identify, manage, and mitigate potential complications and adverse events, including anxiety, pain, and bleeding. And I think that really brings us back to that training and the knowledge, skill, and judgment. Education and preceptorship. It's very important that before we perform any type of a debridement, that we've completed and recognized wound management program and additional competency-based debridement. We highly recommend that. And patient assessment. Obviously, before we initiate any form of debridement, we must conduct a comprehensive patient assessment. So not just a wound assessment, but a comprehensive overall patient assessment. And we do have to do that wound assessment as well, ensuring that we've conducted the patient assessment, wound, and peri-wound. And we're using validated assessment tools. Debridement of any kind is contraindicated for stable, dry eschar on heels, ischemic limbs, toes, or digits. An urgent referral for surgical debridement is recommended when acute infection or sepsis is suspected and when aligned with goals of care. Environment. We need to assess the patient's environment to ensure that it's safe to perform the debridement modality. So, for instance, where I work in a aged care home, if I have an aggressive demented patient, it may not be the best location for me to be performing debridement. Wound healing goals. Prior to the initiation of any method of debridement, it is essential to establish realistic goals that align with the patient's goals, including concerns and cultural traditions, and the goals for wound healing. Is it healing, non-healing, or non-healable? Informed consent. It's very important that we have informed consent from our patients and that we have this in the patient record before we perform any form of debridement. Product knowledge. We need to be knowledgeable about the wound care products and therapies used both above and below the dermis before putting them into practice. Far too often, we see nurses starting autolytic debridement, not realizing that they are starting autolytic debridement because they're adding a moist dressing to a wound that should be kept dry. And reassessment. We need to keep reassessing our patients on a regular basis to ensure that we have the right type of dressing and the right form of debridement is being used. Cost effectiveness. We need to ensure that all associated costs are considered before selecting the method of debridement. This includes the costs for the healthcare system, the employer, the organization, the nurse, the patient, and their significant other. So including, we know that debridement stands as a cornerstone in the realm of wound management, wielding a pivotal role in advancing healing and curbing infection. A variety of methods can be used for wound debridement, ranging from surgical and conservative sharp wound debridement, mechanical, autolytic, enzymatic, and biological approaches. The judicious selection of the most suitable methods hinges on multifaceted factors encompassing wound type, location, extent of tissue involvement, the patient's medical history, overall health, and the wound status. If you would like to do an online course for the theoretical part of wound debridement, we invite you to visit www.wocinstitute.ca/debridement. And this is where you can find out more about the wound practice enrichment series advanced wound debridement course that the NSWOCC developed in collaboration with the WOC Institute as a springboard from the best practice recommendations. This is a competency and standards of practice driven course, so you can learn more about that by visiting this website. So I've given you a very brief overview of the types of debridement and our best practice recommendations. I invite you to go to our website to visit our site, and I'll just quickly go back to the beginning so you can get that website. Here you go, so that you can please go to our website, download the document, and happy to take any of your questions by email. You can email me, chair@wocinstitute.ca. Have a great rest of your conference, everyone.